Welcome to Smile Nursing tutorial. Today we are going to speak about the PPH management kit. It is very important in an emergency condition. See, in this tray we should have the following items like IV cannula number 16 and 18, 2 IV sets, IV fluids NS and RL, 2 cc, 5 cc, 10 cc syringes, blood and urine collection vials, injection oxytocin to be kept in the refrigerator, tablet misoprostol, injection methergine, injection carboprast. These medicine also to be kept in the refrigerator, bowel with cotton swabs, alcohol or spirit swabs, antiseptic solution bottle, adhesive tape, suture material, dry cotton swabs, self-retaining catheter, Eurosac bag, syringe and distilled water for inflation, long elbow length sterile gloves for condom tamponade, SS tray with lid, Sims speculum, SS bowl with swabs, sponge holding forceps, suture materials, scissors, Foley's catheter number 16, condoms, IV set, 500 ml NS and PPE. Thank you for watching this video. If you like, share, subscribe and comments.